Welcome friends, welcome viewers on your favorite source of learning about cardiology and human heart. This is MuniMeter Health. Welcome to MuniMeter Health. I'm Dr. Jaitly, your cardiologist from New York. As always, I say in short videos, we like to come up with small subjects which may find which you may find very, very interesting. In this particular section, we are going to talk about what are salt substitutes and are they safe? Well, one thing we know that in patients who have hypertension, patients who have heart failure, patients who have coronary artery disease, and renal failure patients specifically, all these patients, they have to be salt restricted. So one of the problems with the salt is salt, as you know, if you leave the salt on the table, what happens? Water automatically accumulates. And the classic example sometimes I always cite, just for general people as well, and of course the medical students should know that, is try eating a bag of potato chips and see what happens. Immediately you are thirsty, and the salt and the water will have to go together. So salt and some fluid, some drink will have to go together. So that's a problem with water, with NaCl, which is salt here, and that salt, now, it's a myth. Are salt substitutes safe? So one, salt is a big no-no here for all these conditions. Now that are in the market, you can go and pick up a salt substitute because you want to have that taste in the food. And it's all about the taste, my friends, right? So because of the taste, there are salt substitutes in the market on the shelves you can buy from. Now, remember, salt substitutes still have some degree of NaCl or salt within it, but other compounds are present which will give that substituting taste. But the problem here is you'll have to take a lot of salt substitute in order to have that taste. So what happens is you end up eating more salt. In these patients. So this is a myth that a salt substitute is safe. It isn't, because you end up eating more salt. The second point is, quickly I'd like to tell you, is it also contains potassium chloride. This is KCl, as it's written in a formula. So the KCl, which has the potassium in it, again, potassium is required in the body, but not in an excess amount. Now you end up taking more potassium in a setting where you have hypertension, where you have heart failure, where you have either a renal failure. All these things will impact. Why? Because there are certain medications that these patients are on. Specifically so, like diazide, for instance. Diazide is a potassium-sparing diuretic, as you know. It's triamterene and hydrochlorothiazide. Then you have patients who are on ACE inhibitors, patients who are on ARBs, or angiotensin receptor blockading drugs. We call them ARBs. And patients who are, say, aldosterone antagonists, like spironolactone. So these are spironolactone. These are aldosterone antagonists. These are all potassium sparing because they will tend to retain more potassium in the body. All these medications, specifically so in the absence of a diuretic. So diuretics, especially like Lasix, if it's not combined together, the chances are potassium will start to accumulate as is in these patients, all these patients. Now you take a salt substitute, what has happened? You have increased amount of potassium. So that's a big problem that can occur. So hyperkalemia, we call it, can occur with salt substitutes. Sodium retention and higher amount of sodium can actually occur because of the myths that it's containing low sodium, but actually for the taste sake, because you end up taking more salt substitutes to improve the taste, the sodium chloride just adds up in your body. So friends, just be cautious, consult your doctor, and make sure that you know what a salt substitute, whether it is safe or not, and discuss it out with them, because this is just a general know-how that I've just presented in a very, very short video. Once again, on MuniMeter Health, we have medical education and patient education, which we are trying to combine together to improve the clinical outcomes in our patients, and that's our major goal. Thank you again for watching. Please continue to like, share, and of course subscribe to our videos as you've done it before. And again, do share it with your friends, and so this way we can all learn together and save hearts. Thank you so much, and looking forward to meeting you again. Bye now.